Hi, I'm Dr. Dan Woodruff from Vibrate-A-Way. If you remember the last time we talked, I talked about things that we need to face the cold hard facts, the reality. I briefly touched upon last time that you need to take a look in the mirror, see what you can do. I used weight as an example. For example, I'm overweight, my knees and ankles hurt. Well, my solution is start changing my diet. Obviously, this time of year it's a little harder, but you know what? Pain is a great motivator. It really is. So today, along those lines, what I first want to do is, in that analysis of what is it that I can do to help myself, what might be some of the problems that are causing all this, I want to talk about us trying to find out what's wrong with ourselves. You see, Google and the internet has been an amazing technology in our life. After all, so much of my research, the hours that I've put into this have come off of research that I've been able to acquire via the internet. It's brilliant. But the problem is also, many people want to become their own doctor. Now, I use this analogy a lot, and it's actually heartfelt. And I'll ask patients this. A lot of times patients will come into my clinic and decide to tell me what is wrong and what I should be treating. And this is what I respond to them as. I'll first say, do you own a house? And of course, the answer is yes. My rhetorical question right back to them is, does that make you an architect? Do you own a car? The answer, yes. I respond, does that make you an automotive engineer? No, is the answer. And finally, do you have a body? Yes. Well, does that make you a doctor? No. But we all tend to take that jump. And Dr. Google, WebMD, has been the savior and the disaster of doctors throughout this country. There's a term out there, and it's called Occam's razor. If you don't know, look it up. You can get probably a better definition than the one I'm going to tell you right now. But basically, Occam's razor has been around for centuries. And what it states is usually the easiest and most simple of answers is going to be the correct answer. You see, we like to blow up things and make it more than what it could be. Now, I'm not making light of serious conditions, far from that. But people will have an ouch, a pain, and all of a sudden they know they're going to need surgery. They've torn a rotator cuff. I can't tell you how many broken bones have walked into my clinic. Why? Because it's the most disastrous. I don't know what it is about our society, but we really like to jump to the worst thing. I don't know if it's more glamorous. I call it the John Wayne effect. You know, when John Wayne gets shot 8 times and yet he's still limping to the horse to grab his Winchester and finish off the marauders. I don't know if it's that syndrome or what. But we like to inflate what we think it might be. The second part of this is we want a single cause with a single effect and a single solution. I hate to tell you this, but the body's not that neat. The body's not that perfect. It's not perfect. It's not clean cut. That's what I really want to say. And so we want to find one problem. So that way we can get a solution and it's fixed. And we go to the internet, and you know what? To get people to watch, to listen, to read, they're going to try to grab you with attention. I mean, look at me. I'm dressed up to the hilt here. I'm really trying to get that eye candy appeal to make you watch my video. But usually what that means is the first thing you're going to read is the most disastrous thing that could happen to you with that symptom. The other thing is symptoms mock other diseases. You know, you go to a doctor and you come in with 3 symptoms and you expect the doctor to know what that is. What you don't realize is for those 3 symptoms, the number of ailments or disease processes or conditions could be thousands. And the general approach that a healthcare provider takes is that of Occam's razor. The most obvious and rational answer, we'll try first. If that doesn't work, then we're going to move down and try the next. And then the next. It's not clean. I remember when we would take pathology courses in college, everything was either textbook normal, was the phrase, or textbook disease process. So if you had a fracture, I mean, you could see it a mile away. Or a healthy skeleton, just it was beautiful, like an artist did it on an x-ray. But you know what? Nothing is textbook normal, and hardly anything is textbook pathology. It's that huge gray area in between. And so our answers to what might be wrong to us just aren't that clean and simple. Have respect for your body. And have respect for the healthcare practitioner working on you. Your body is a very complex machine. And in my next episode, we're going to talk about that machine. Until then, goodbye.